and welcome to another episode of Let's Talk. I'm Jade Harrell, and I'm joined by Amber Clear and Jamie Ballantyne Dolby. Ladies, welcome back.
Yes.
I'm so excited to be here in real life.
Me too.
Is that
in
really
real
you?
life?
No filter. We're dressed from the waist down
robot,
as well.
have pants on.
Fantastic. Oh,
Yeah.
no filter, Amber. Well, today we are going to have a doctor on to set off our new season. And so we need to know what you've been doing to stay healthy in 23.
Listen, have been going to the gym. I don't go anymore to lose weight. I go to gain strength.
Oh.
So it's about mental health and physical health. And that has helped me all around. But also I can bench press 200 pounds now.
Good golly, Wally, do you have a license for those guns? All right, Ms. Dolby,
What happened?
what are you doing about it?
What happened was...
Okay, let me just say that I started the year off really good. Shouts out to my big brother, Demetrius Johnson. My very last conversation with DJ, he said, I want you to get healthy. Stop playing around. You need to make sure you get your health in check. And I was on it.
Right.
And I know right now he would really get a kick out of this. And my little scooter, he would have a blast with it. So I'm going to do better and stay healthy from like the right leg, waist up.
But you're having a blast with your scooter too. Like you're just motoring around.
Yeah, it's kind of interesting.
You still got to be careful on the scooter. all
I
right?
still have to be
we should
very
put
careful.
Power on it. Let's go.
Very
I'll put engine
careful.
on
I
there.
thought
We'll
she
go.
did have a motor on it.
I'm
Well,
going 3 miles per hour.
Okay, they're clocking
That
you,
right
you
leg
know?
is getting real strong.
Yes.
I can see it. Well, going for strength, I think for me is just getting into a routine of doing something. And so I've been committing to that. And let's take a moment to send love and shouts out for DJ, who always encouraged us to live our best and healthiest life. And so I'm glad that you mentioned it. Maybe we need to go for a walk right after this. But for now, we need to take a quick break. But when we return, we'll meet a woman who is breaking the glass ceilings right here in our community. And we're looking forward to finding out everything she's working on. So stay with us. We'll be right back.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Welcome back to Let's Talk. Earlier this year, our guest made history by not only becoming the first woman, but the first Black woman to lead a health organization in its 117-year history. Since January 1st, she has been at the head of Affinia Healthcare organization, which provides primary and preventative care for residents in our area. Please help us welcome the dynamic, magnificent president and CEO of Affinia Healthcare, Dr. Kendra Holmes. Welcome.
Thank you. Thank you, ladies, for having me.
I'm so honored. What did it take? Give us a little bit about that journey to, 117 years. It wasn't like they were signing us up
Just a
to
simple
be.
question she's asking.
Just a simple question.
Yeah, simple.
So it took 20 years.
Okay.
So I actually have been with Affinia Healthcare. Previously, it was Grace Hill Health Centers. Been there for 20 years. I started my career as a staff pharmacist. Had no really clue of being the CEO, but just gradually took on additional responsibility, and here I am today.
Amazing. So how different do things look from your vantage now? You've seen it through the ranks. You've seen it in community. Now that you're at the lead, what do you see as the greatest need? What do you want to do about it?
So I think the fact that I did come from the boots on the ground position and worked my way up has helped me tremendously, because I have that communication and that respect from the individuals who actually do the real work. So that has really helped me. So with that knowledge, I'm able to see really how the organization works and what it really needs and what our community needs, which is really what is important.
Okay, where do we start?
Oh, we got a lot of work. We got a lot of work to do. And I say I've been in healthcare for 20 years, and unfortunately, nothing really has changed with the health in St. Louis in 20 years. And that's the horrible part. So the way that we're looking at it at Affinia Healthcare is a different approach. For years, for decades, we've really told the community what they needed. We told the community how they should have healthcare delivered. We told them what the priorities are. What we're doing is we're asking the community, how do you want healthcare delivered? Where do you want it delivered? Do you want walk-in appointments? Do you even want appointments? Do you, how do you want it delivered? How's it best to meet your needs? So we're really taking the approach of getting the voice of the community in order to improve health.
Absolutely. I think about you talk about getting the community's feedback, but really who I turned to during the pandemic, and I don't know about you all, but who I got my news from as far as like what was happening in St. Louis, and it was Affinia Healthcare. It was Dr. Kendra Holmes. And so even whether it be, an Urban Sprout Scala and Blanc event, we were like, what is Kendra Holmes stating? We're gonna follow the policy of what you were saying, whether it be on the media or what you were doing for Affinia Healthcare, because I think you became the face of leading us through the pandemic, but also just a face that we could trust. How does that transition now as CEO? Because I know that you have a company to run, but so many people obviously in our region also look up to you as well.
So I think that actually helps me. It's really important to be a trusted messenger. And I tell people, I'm not going to tell you to do something to your child that I'm not going to do for myself. And we talk about that a lot with vaccination. And the community has a lot of issues, trust issues with the healthcare system, which are justifiable. So I think that really has helped me in my journey as a CEO. Of course, I've only been in the job just for a couple of months here. But so far, so good. And I think that trust is the number one priority that I need to have to be successful.
Mm-hmm. Part of the process is trusting yourself, but how do you deal with the whole economic impact that you just have to carry? Because not only do you have the health of the whole community on your back, but you literally have all of the coworkers that you used to work with that are now, you're leading them. And if you mess up, that's the whole economy.
No pressure.
Yeah, no pressure.
No pressure at all.
You just look so relaxed, and I want to know how.
She's got this.
So,
you've got an empire going.
So it's a tremendous responsibility. But I was born and raised in North St. Louis. Didn't come from a wealthy background, so I know the struggle of needing to pay your bills, needing to take care of your kids. So that's always in me. So although it's a huge responsibility, I'm a hustler. So I'm going to make sure that the staff are taken care of. I'm going to make sure that the organization is financially sustainable so we can keep it going. One of the main reasons that we were out there so much doing the COVID testing is because I needed to keep my staff employed. And organizations were shutting down, and I had to figure out quickly, how do I keep them employed? And that's why we were out there 24/7, so people could stay in their homes and pay their bills.
Yeah.
Speaking of being a hustler, coming from community, understanding, not only from a lived experience, but working as a professional and now being a leader, we do things that you didn't know before you got to where you're going. We do better when we know better, right?
Yes. Mm-hmm.
So here you are, head of Affinia. Mm-hmm. Back in the day when you was Debbie on the block.
I'm still Kendra on the block.
You know what I mean? Kendra, Debbie, Jenny, we know better when we have information. How do you bridge that gap? There's things that you're aware of, that you have advantage of, that now you need to either enroll or convince and help us understand that we weren't exposed to before.
Well, I think the pandemic is a perfect example of that, and just the vaccination and the testing and the understanding of a virus. For individuals who are in the healthcare field, it's complicated. So to communicate that to someone who doesn't have a medical background, you have to put that really on like a 5th grade level for individuals to understand. So I think that was challenging for me, and sometimes frustrating, because I would be like, you need to get this vaccine. It's going to save your life. And they would be like, oh, there are microchips in it. And I would just be like, ooh. But I also tell people that, I never got anyone to take a vaccine by saying that they were stupid or judging them. So I really meet people where they are and just give them the education and the information so that they can make an informed decision about their health.
You're caught in the middle. So now you've got the information providers that need to understand community better. How do you translate that the other way around as well?
So that probably is more of the challenge.
Really?
Yes, that probably is more of the challenge. And the way that I really approach that is to really set my expectations. And my expectations are that individuals in the community, regardless of their socioeconomic background, their race, they deserve access to quality health care. And that's really something that I don't waver on. And if you work at Affinia Healthcare and you're part of our healthcare system, that's the expectation, or you don't last long there. So that's how I handle that.
All right.
I love that. When you talk about access to healthcare, and we know that, like you talked about 20 years ago, we're still in this fight for equality as it relates to healthcare. What are you doing as a leader, not just with your staff, but how do you lead the community in saying we all have a responsibility to close the gap in that?
Well, I think a lot of it starts with policy. We can do a lot of programming, and I can do a lot of programming that impacts a certain zip code. But until we address the policy issues, we're going to stay in this same situation, and that's what has occurred. So we really advocate. We're very active politically, advocating for women's health rights, for expansion of Medicaid. So we really have to approach it on a holistic standpoint, because these little individual programs have gotten us where we are, and that's really nowhere.
That's no joke. What's the funnest part? Now I think of my friend, because healthcare is heavy. Right now there's so many things. The fun part? What's the fun part of your job? So we can envy a little bit.
So I don't know, it may not be fun to you, but it's fun for me. Is just being in the community. Like I said, I'm from North St. Louis City. There is no other place that I want to be than in the hood with my people. So just going out, being in the community, going to vaccine clinics, which I can't go to as many in my current role, but I'm still out in the community. That piece really is the fun part for me.
People recognize you from back in the day, and they're like, wait, what? You're an adult now, a real adult? You're in charge?
Yeah, a couple more gray hairs, but they do recognize me.
Right. Have you always been a health advocate? Was there something that occurred? And I know we're in the last 20 seconds, so if it takes some more time to answer that, but has this always been a part of who you are?
So I think just what has always been a part of me is I don't like injustice. Injustice at any point, if it's in education, it's in criminal justice system, injustice bothers me and it makes me want to do something. So there's so much injustice in healthcare, and I think that's what motivates me.
That's right. And you said, here, choose me. I love it. Well, we're going to take a quick break, but when we come back, we'll have more with Dr. Holmes. So stay with us. Dr. CEO and President Holmes.
I'm Jenny Garth, and as a mother of 3, I know kids worry about a lot of things. Getting enough food to eat shouldn't be one of them. But here in America, that is a real worry for 1 in 5 children. This is unacceptable, and something Feeding America is working to solve. Through a nationwide network of food banks, Feeding America serves virtually every community in the United States, including yours. See how you can help your community. Visit feedingamerica.org. Together, we can solve hunger. Together, we're Feeding America.
Welcome back to Let's Talk. We've been chatting with the POTA, the president of the Affinia Healthcare. Dr. Kendra Holmes, CEO and president of Affinia Healthcare. We're so glad to have you here and to just have a seat next to somebody who can tell us how things work, what's necessary, and that we could trust. It's such a pensive feeling to go into a place, have an issue, and not know what to do or whether or not this is okay or whether or not I'm being considered. So when you said, hey, we want to know from community what they need most before we act and align, I really tremendously appreciate that. So we were talking off the air about some of the things that are coming and that are very important for community, and that's with regard to Medicaid. So give us the warnings and information that we need to be equipped.
Yeah, so, we fought so hard in Missouri to expand Medicaid, and now here we are again fighting to keep Medicaid for those underserved individuals. So unfortunately, Medicaid renewals are now coming again. So
what does that mean, Medicaid renewal?
So during the pandemic, there was a pause on renewals or recertifications for Medicaid. So those individuals who qualified for Medicaid were just on, and there was no process where they had to recertify or provide any additional information. Well, with the ending of the pandemic or the emergency piece of the pandemic, now the states are requiring individuals to recertify. And what that means is that there will be a renewal letter sent to your address that is on file which is a problem because a lot of the individuals in underserved communities are very transient and may not have the correct address on file. So what we're doing is we're boots on the ground. We're out there outreaching to individuals, encouraging them to contact their local Medicaid office and update their address, because what will happen is if you do not update your information, you will be cut off of Medicaid. You will have no coverage, and it will take a while for you to get that coverage back. So we're trying to prevent individuals from having to have a mad rush to the emergency departments if they don't have their insurance, and just really the overall impact that will have on the community.
What can we do to support those efforts? I know that for me, I have elderly parents. I have one living with Alzheimer's, and so I'm constantly on his, and he has Medicare, but I'm constantly just on his mail, on his bank statements and things like that. Is there something that we can look out for? Or if they miss it, how does a family member or even a community member become an advocate for those on Medicaid?
Right, and that's the advocacy piece is really key. So again, exactly what you're doing. So looking through the mail, helping them, and a lot of times it's just so confusing. It's confusing for us in the healthcare field to navigate this applying piece. So just to really help them to understand, to read the application, and just to help them reapply as well.
How can we push from the other side to make things easier so that it doesn't get to this point again?
Well, that's going to be a tough push in Missouri, but advocacy. Again, contacting your state legislators, letting them know that this is a problem for underserved communities, and to rely on a renewal by address, knowing the issues that we have with this community. So really advocacy in Jefferson City is needed.
So only mail is by snail mail is the only way?
Isn't that crazy?
It is 2023.
I mean, it's not online, not a phone, not a QR code.
Can't log in on a website.
So when they get the letter, I know that we're encouraging people to call their Medicaid office, right?
To change their address.
When they call that Medicaid office, why couldn't they just recertify that way? No. Or so how does, because what's in the letter that is so important? So what happens when the letter comes? What's the next step?
So it depends on your status. So they may need to have updated paycheck stubs. So there's a part that the individual has to provide documentation, which is another barrier for the community. So it's actually having them act on something. So either you need to provide new income statements, address information. So it's actually requesting additional information.
So I can understand some of that. In order to manage Medicaid, you need that information, but...
Well, I'm glad you understand it because I don't.
Well, Medicaid is based on contributions and all of those things, but not making it seamless is where I'm finding the challenge. I was hoping that you were going to help us understand, well, what's the plus side, or where's the additional benefit? But I guess we should focus more on what to do about it, like we started out our show.
I have questions.
If they're watching us,
do they have to mail this certification?
And they need to mail it back?
They can't even log in. So what do they do? Make a copy? Like who?
It's a huge barrier.
They have to make a copy of, I guess, print
Paycheck
out, because
stub.
I don't get a paycheck stub. I have to log in and get it.
Exactly, which means you then first have to have internet access
to a printer
to get it, access to a printer, which libraries don't always even have everything that you need to print in certain communities. So then you have to come back, get it printed. Probably by that time you're missing it. Most households don't have printers anymore.
No, everything's online.
I scan it on my phone. Well,
And so everything that you're saying is the reason
those are some of the things.
that is estimated that up to 200,000 individuals will
Good
lose
Lord.
coverage in the state of Missouri.
And when it
for
comes
those
to
exact
health, we
reasons.
cannot. So Medicaid covers medications and therapies.
hospitalization.
And, oh my goodness, yes. So there's no one seeing the fire coming.
Can they call Affinia to help them walk through
Yes.
that process? So what does that look like? If I get the letter and I don't have a clue what to do, or somebody in my family, I know I'm not gonna call Kendra, put her cell phone number right here.
They call me all the time.
But what's the next step for us when we call Affinia?
You can just come right in. Just come right in with your paperwork. We have printers. That's actually a great point, because we ran into that barrier with individuals not having printers to print out their W-2s or their income information. So they can come in. We have outreach staff who will actually work you through the process and submit the information for you.
When does this go into effect? Dr.
April
Holmes?
1 is when the renewal.
This year?
Yep. April 1.
Okay, so time to get it. Not April Fools.
So not everybody
This is it.
has a vehicle. Do you guys have any like ability to go out into the community more and like meet people in places or like have buses that helps people get to places? Because it's one thing to not have a printer, but you're talking about people who may not even have vehicles or are able to drive. They're old.
Absolutely. So what we do is our outreach team is actually more in the community than we are in the building. So we have some staff that are application specialists that are in the buildings, but the majority of the time we're out in the community. So we're at public housing, we're at unhoused shelters, we're everywhere really trying to get those individuals signed up.
Well, this looks like a fun first quarter for you. But I would imagine you would, re-engage some of the things that you learned through COVID and being able to get people informed and vaccinated and managing the families in school. So,
Right. So Affinia's not having a problem. It's going to be everyone else.
Okay.
So we're hoping that they catch up.
All right. Yay, Team Affinity.
I love that.
Affinia.
With it being Women's History Month, and you've clearly made history and continue to do so, what is something, how would you encourage if there's a young woman or a young man that's looking to get into the healthcare field? You started out as a pharmacist, so and you're in a leadership role. So what's some advice that you have for a young person that's looking to get into the healthcare field?
Especially for women, I would say take risks. We as women are often afraid to take risks because we don't want to fail, or the financial aspect of, okay, what if we fail? Then what am I going to do financially? I just encourage everyone to take risks. You only live once. Everyone's going to fail. I failed 100 times.
No.
But I kept going. It doesn't. Yeah. That's how you just fail forward. So I would say definitely continue to take risks. Take that extra job. Take on that extra responsibility. And also, I always tell women, ask for what you're worth.
Sure.
Absolutely.
You're going to pay me what I'm worth, and I'm going to ask for what I'm worth plus 10%.
But plus 10%, right.
Yes.
Where do you need us most to expand that question? Where do you need more people in what areas of healthcare? Yeah.
Oh, everywhere. So definitely more nurses, more physicians, and just what we need more is compassionate healthcare workers, people who actually want to be in the community helping others.
How do you sell that?
How do I settle that?
How do you sell that? That's how do
I sell?
It's tough out here.
Well, it really has to be your passion.
There
I
you
wouldn't
go.
have been in a community health center for 20 years if it wasn't my passion. And it's not everyone's passion.
Right.
Everyone does not want to deal with the community that we serve sometimes. And it's difficult because they're traumatized, and hurt people. So
Absolutely.
you have to realize that you're going to get cursed out a couple of times, but just keep smiling.
Get you along. Exactly. Well, as we close, I want to give you an opportunity to either restate or emphasize what we need to do for recertification, or what your invitation or call to action is right now for our viewers.
So I will just speak briefly about another call to action, and that is being evaluated now in the Missouri State Legislature, and that is regarding postpartum Medicaid coverage for moms. So currently, Medicaid coverage ends after 60 days after a mom has her baby, okay? Well, all the data shows that from 60 days up to 1 year is when mothers die. They die from hypertension crises, sepsis, different issues, but actually Black women are 4 times more likely to die during and after childbirth than white women. And a lot of this is related to the lack of health insurance in that critical time period after you have a baby. Anyone who's had a baby, it's a very stressful time after you have a child, mental health wise and physical. So we are advocating for the Missouri State Legislature to expand that coverage from 60 days to 1 year so we can save moms' lives.
So you need us to call, get involved to keep saving those lives.
Absolutely.
Well, we will follow that lead, Capitan, and certainly appreciate it. Dr. Holmes, thank you for being with us as our first guest back in the studio. If you'd like more information, I know you do, get more information about Affinia Healthcare. Visit affiniahealthcare.org. Stay with us. There's more. Let's talk when we come back.
Hey, let's check out this park. Oh, wow, that's really cool. To find a great local park or forest near you, go to discovertheforest.org.
And we are back. So much yet to be done, but can you doubt that she's capable and ready for the cause?
No doubt. She has it. She's got it.
That's a powerhouse.
First of all, she's from the north side. So confidence high. It's not a problem.
That's right.
Yeah.
She's high step, and I absolutely loved it. It's concerning what we have to face, so I'm glad that you all asked about how we can get more involved. But excuse me, I feel like we're going to need to do some serious outreach to make sure nobody gets caught in the gap.
I think it's like grassroots, and we often share selfies, share things like that, but we really need to be sharing this information and share the deadlines and remind, and not so much on social, because obviously, even on social, because sometimes
that's what
people,
social should be for sharing information, not just pictures with cat ears.
Because they're thinking it's going to be so caught up, they're going to see something, but I know I don't look at my mail. Open every piece of mail. That should be, maybe one of the advocacy pieces that we can even kind of get on board with. Open your mail. Update your address, open your mail.
I mean, I'm bad about it. I
just
get mail. It doesn't even make it in my house.
No.
I go through it and it goes right in the trash.
There's a bunch of stuff.
Yeah, I don't want
Start going
clutter.
through it. I found a check.
What?
A few months ago.
That's
Who
mine.
is mailing
That's mine.
checks? The
And
government? Probably the government.
It
Here's your
unclaimed
refund.
money, random.
They have our digital accounts. They could
Actually,
just,
the check
they
is
just cash
The
app
check
us.
wasn't even for me; it was for my husband. But I took it and cashed it.
I was sure going to claim that.
Yeah.
But I agree with that. And if we can make it in such a way that people don't overlook that on social, just like they don't overlook in the mail, I think we'll be well on our way. But unfortunately, that's all the time we have for this show. But we definitely have to thank our guest, the amazing Dr. Kendra Holmes. I'm so excited, with Affinia Healthcare, for being with us today. And thank you at home for joining us again. And welcome back to you. The show may be over, but you can always find us on Facebook, Twitter, Instagram, and YouTube, or just visit us at stltv.net. I'm Jade Harrell for Amber Clear and Jamie Ballantyne Dolby. We'll see you next time on Let's Talk.
We will not mail you though.
I can't believe people are mailing checks. It's 2023. If you can't
They don't want you to
put
get
it
it.
directly in my account, I don't even want it.
They don't want you to have it.
Even my tax,
The IRS only mails. They will never call you.
no, they do. They put it right in my account, but I have to pay it.
No, but I'm saying they will never.
So do we
call
stay
you.
here for the promo, everybody? Or is that a stand-up? Should I stand up?